welcome to another edition of Ask the Police Chief. I'm Steve Rosales, and with me this morning is Chief James MacIsaac, Chief of our Belmont Police Department. Chief, a resident asked another question. Here it is.
Hi, Chief MacIsaac. Could you please explain to the community how the police department interacts with surrounding communities and community hospitals to address the rise in mental health issues?
So it's mental health, okay? The resident asked if you could explain how the Belmont Police Department interacts with this community and perhaps other communities to address mental health issues here in the community.
So the Belmont Police, we deal with mental health issues a variety of different ways. When I became police chief in 2020, we identified what we call people in crisis as a core priority for the police department. And what our core priority, the issues we've identified as a core priority, what I've told my officers is you can spend as much time as you want on that call until the call has reached a proper resolution or the person has gotten the proper services. And our officers have done that, they understand that. We send our officers for training on dealing with people with special needs, autism, identifying people in crisis. That's a big one. We've all seen these horrendous videos where somebody has a knife and they're bipolar and they're acting up and things go south fast. So we want our officers to be able to identify when they respond to a call when somebody is in crisis. That's what we call somebody.
How would you define, what are some,
Well,
obviously the one with the knife
first
running
of all,
around.
you take what information you have.
Yeah.
Usually these calls come in from a family member or something like that, which is what a lot of people talk about with, we should send social workers to those calls, which I'll get to. But usually it's the time when a family member's become threatened or something and they tell us on the call, he's off his medication or she's off her medication or they're diagnosed bipolar, schizophrenic. So the officers know going in. And they know in that mindset, because we've identified this as a core priority, that there's no rush to end it. You know what I mean? Mm-hmm. If they get there and they say, and the next day, Monday, I signed an overtime slip that has 8 hours. I said, why were you at 8 hours at this residence? Well, it took that long for the person to calm down. That's totally fine. I don't have a problem with that at all. What we did also to address this issue, because it's such a big issue now, and it makes sense, is I applied for a grant from the Department of DPH, Department of Mental Health in Massachusetts, and we were awarded the grant to get a co-responder social worker. And that's through the Advocates Jail Diversion and Hospital Diversion Program. And the idea is, prior to us having a social worker on staff, we would go and we had the option to Section 12, which is a pink paper, to send somebody to the hospital.
Involuntarily.
Involuntarily.
Okay.
We make that decision on our own as police officers. The idea is with the social worker that he or she can make that determination. And if she makes the determination that they don't need to be Section 12, then that relieves the Mount Auburn emergency room of having to fill a bed that day. And so that's a good diversion program. If the officers might have had an opportunity to make an arrest, the co-responder social worker can maybe make that a diversion, that we don't have to make an arrest, they can talk to the doctor. And so what happened is we were awarded a grant. We had a social worker that was coming in full-time, and unfortunately she took another job. So right now what we're doing is we're sharing a social worker with Watertown. Watertown has two. So we have a social worker that comes over twice a week, and she is a co-responder. She's in the police vehicle with the officers driving around. And it's a huge benefit. It's already, the program has already been instrumental with us in dealing with several different cases. One unique thing that we do have in Belmont is, a lot of our mental health calls to halfway houses that are in Belmont and the clients that are in Belmont. So that's a lot of our calls. The other thing, we had recently, we had a person on the roof at McLean Hospital that was going to jump off the roof in the early morning hours, and our officers responded, and our officers did a tremendous job. They risked their lives. They went up on the roof, and you go up on a roof with someone who's going to jump off, you don't know if they're going to take you off.
Take with you. Yeah, sure.
But what was a real indication of that is, first of all, there were no mental health clinicians available at that hour to to
At
help
McLean
our
Hospital,
office.
there's nobody there?
Well, this person was not a McLean patient, so McLean wasn't interested in solving it. So our offices were
What?
basically
Okay,
left.
we'll save that for
Our
another day, because that's
offices-
certainly troubling.
Our offices were basically left on their own, with the support of the Belmont Fire Department, to get this gentleman off the roof. So we do a tremendous amount of work with mental health calls, whether it's clinicians, whether it's people and residents, whether it's kids in town. And it's a core priority for us. Hopefully that we're gonna have a full-time social worker, not one twice a week. And one thing that people have to understand is, you know, there isn't a whole factory full of social workers that wanna come be co-responders. You know, asking a civilian social worker to drive around in a police car, to go to these police calls that most people stay away from, you know, it takes a special kind of person that wants to do that day in and day out. And hopefully we're gonna find a candidate. We're fortunate that we have two, I know, communities that have been awarded the grant, that the money's just sitting there, they don't have anybody to work as a co-responder. So those are the things we do. We also have adopted less than lethal options. We have tasers, which are a huge benefit for dealing with people who are in mental health crisis, and we're introducing the next phase of this. It's called a bolo wrap, and it's actually, you know, it's like the old bat belt where you shoot out wires and they wrap around people's legs. And so, you know, as a chief, I have a responsibility to give our officers the necessary tools that they can use to keep residents safe and to keep themselves safe as well. And so it's a core priority for us. And one of the things, the question asked how we interact with other communities, the social worker, she has a confidential file that she shares with other social workers that work in other police departments. So if we have somebody that gets off the bus and is acting up and we can get their name, she may be able to within minutes, pull up the person's whole history if they've had interactions with like the Cambridge police or the Watertown police. So it's all about sharing information with our neighboring communities and the hospitals that we transport people to in need of mental health.
So you touched on a couple interesting follow-up questions on social workers. So they're there twice a week. Of course, that begs the question, what happens if you have a mental health call on one of the days that the social worker isn't there?
Well,
are they on call? Will they come over from another community, or are you just sort of on your own?
So what was happening prior to the social workers being embedded in the departments is we would go to calls and we would call agencies like the Advocates and things and see if they could send somebody over. And generally they wouldn't, just because they couldn't. There is, you know, everybody's experiencing staff shortages. So basically we rely on the offices to de-escalate the situation, talk people down. What we really want to do is get people to go voluntarily to the hospital. And I would say that probably 90% of the time, 95% of the time, we're successful with that. And that's just spending time with people, you know, letting them talk through their problem, whether it's a problem they have with a family member, whether it's a problem, you know, they haven't taken their medications, and it's just letting them talk through their crisis and getting them to go voluntarily to the hospital. Now, you know, we do our job. There's a whole nother conversation to be had that I'm not an expert to talk on, is how we deal with mental health in this country overall. But as police officers, we are certainly where the rubber meets the road in this mental health crisis that we have in our country. You know, we're the ones that get called when somebody's acting erratic or you know, threatening themselves or somebody else. So we train our officers to do the best job to de-escalate the situation, get the person to go voluntarily to the hospital. If they're not able to go voluntarily, we will section 12 people. And then if the social worker is working, then the social worker can do their social work stuff to ensure that the situation ends as a successful outcome.
Now, we've just come through, I don't know, 2.5, going on 3 years of COVID with lots of isolation and kids at school. Do you find an increase because of that? Do you think the ages have got younger because of the school? You know, it's prevalent in the news now about the effect that the pandemic and all of this has had on students of all ages, you know, the school kids. And, you know, kids under 18 with you know, the internet and the phone in their pocket and all this other stuff. Do you find an increase, or is it sort of all the same?
So one of the things we had to do was, in order to, in the application process to get a social worker, we had to provide all our calls for service that were mental health calls. We certainly met those standards, which, you know, is what it is. We met those standards, so the time that the social worker works actually falls within that call range. She comes in at about 1 o'clock in the afternoon and works till 9 o'clock, 10 o'clock at night. And so in the month of May, she did 5 full evaluations. And, you know, which she said is sort of a lot for a community. So I think first of all, Belmont's not immune from this. This is something that we see everywhere. There's a lot of factors, you know, there's COVID, there's the internet, there's a lot of things going on, there's a lot of stress. Kids are under a lot of stress, you know, we have a lot of political stress in this country. There's not a lot of positive things being said when you think about it, right? And if you spend your time on Twitter or you spend your time on TikTok or these things, the things that we view as positive today can be detrimental to a child's well-being. And, you know, there's a whole bunch of things that are beyond my scope of what I deal with. But yeah, I certainly think we're seeing an increase in mental health issues.
Well, you know, you gotta keep everybody safe. You gotta keep the citizens safe, you gotta keep their families safe. I get concerned about the social worker. I don't have a perception they have much training in those type of situations. They're probably good dealing with the counseling aspect, but you know, of course, they only get the ones that get the news, the guy walking around with a gun or somebody with a knife that won't put it down. And I'd hate to have a social worker get him or herself in a little difficulty or cause trouble for the officers.
So part of the selection of the social worker, clinician, the co-responder is, it's a lengthy interview process.
Mm-hmm.
They come here and we interview with them, and then the social worker spends 5 weeks in another police department that already has an embedded co-responder. They have access to a ballistic vest. They go on certain calls. They do not go on dangerous calls.
Oh,
you know,
okay.
if things are
I
dangerous.
just wanna keep everybody
Yeah.
safe, everybody.
I
That's
can
the
tell you,
game.
you know,
That's the goal, I would think.
We had a call where we had information that the person in crisis might have been a threat to himself or to others, and our clinician was able to work directly with his parents. You know, the clinician speaks the language that the parents needed to do the paperwork and those kinds of things. So it's not like we just send the clinician in and say, you know, here, solve
Do
these
your
problems.
thing, yeah.
No, there's
Have at it.
there's defined roles and things.
Okay,
to keep
so there
them
is sort of
safe.
a chain of command, or
Yes.
who's in charge of the situation, and,
Yeah,
you know, you're a victim of TV, I'm a victim
Yeah.
of TV, what you see on TV, and there's always, you know, it makes interesting TV, but I don't know how that translates into
yeah. So there's defined roles
practical real life.
of what happens, and officers have to know when somebody has to take a step back, and you know, we talked about that. We have operational meetings here that go over how the clinician's working and all that.
Okay, in the couple minutes, any red flags or warning signs that family members or people that might see, that we might recognize that something is about to happen on the mental illness front?
You know, it's just not, I would tell people that we're, as I mentioned before, you know, we're in very stressful times. It's stressful times for the police officers. One of the things that the police reform came out with is that, which is a very good thing, is that police agencies are required to provide wellness to their officers, which we should. For a long time, that was overlooked in policing. But, you know, there's no shame in getting help. The schools, I know we're in the summertime now, but the schools have a tremendous, they have social workers, they have psychologists on staff for kids to go see. And, you know, if you're feeling stressed yourself, there's a lot of, you know, opportunity, you know, start maybe with your general practitioner and go from there. But I think I would stress to people that if they're feeling overwhelming stress, or their feeling is that they're gonna get to the point where they're gonna act out, to try to get some help.
Okay. Well, thanks, Chief. Well, that concludes another episode of Ask the Police Chief, here with Chief James MacIsaac. So until next time, Take care. Oh, and if you have a question for the chief, feel free to email it at collaboration@belmontpd.org. That's collaboration@belmontpd.org.